Good morning from the second age of reason. America is at a crossroads. America is at the crossroads of its health care. Is the problem the competence of the doctors and the facilities and the tools and medicines? No. Is the problem with the patients that they're just too sick, just too injured, just not worthy? No. The problem comes between doctors and patients. It's called insurance. Money is not the problem here. It's insurance. Insurance is the one who decides whether or not to spend the money. Now, because of the economic times we're in, a lot of people are unemployed and therefore without health insurance, probably to the tune of 50 million. So the question is what to do about it. And of course the insurance companies would like another bailout. This time they're saying that they're bailing out the patients by giving them a subsidy to buy health insurance. So this health insurance thing can keep on going on. However, there's another alternative available that's been overlooked called single payer. Our current plan is sometimes referred to as three-payer healthcare because you have the patient paying, the insurance paying, and the employer paying for the healthcare. If one of those three parts is unavailable, then of course you're in trouble. And then of course they say, well, there's COBRA. I don't know if you've ever looked at a COBRA premium, but if you're unemployed, paying from $1,000 to $5,000 a month is not necessarily an option. So the single payer, which simply means that you have one payer, namely the government. People say, whoa, then you have government-controlled health care. Look at your pay stub. It says FICA, and it probably says Medicare tax. You already have government-controlled health care. Your doctor cannot practice medicine without a license. Government-controlled health care. The FDA approves medications. Government-controlled health care. The government controls a lot of things about health care. They pay for a lot of the research for medicines and treatments. Government-controlled health care. What we're talking about is government-paid for health care. Entirely different. And insurance companies say, oh dear, the government's trying to take us over. No, the government doesn't want to take it over in a case of single payer. The government wants to make health insurance, in that case, permanent. You wouldn't need any health insurance if it didn't cost anything. And it would simply be that everyone is covered, rich, poor, any demographic you can imagine. They're all covered, 100%, all conditions, all the time. And the government takes care of it. But that cuts out the insurance companies. Yes, and it cuts out all their health insurance profits to the tunes of hundreds of billions of dollars, which then is added to the bottom line. The other part is it helps business. Businesses that offer health care are paying probably $5,000 to $10,000 a year per employee for insurance premiums, maybe even a lot more than that. Once that has been taken care of by government paid for single payer health care, all those premiums and insurance departments that manage it in the companies are freed up. That adds directly to their bottom line and makes them more competitive globally. The other aspect is then it becomes not a problem anymore. If you stick with a three-payer health care, if you continue with insurance coverage, insurances make money by denying claims, by denying services. This is how they make money. You pay the premiums and they don't pay the benefits. So, in that case, if you think about it, it's a conflict of interest. In this day of Sarbanes-Oxley, they always are looking for conflicts of interest, and that is a big one. In this case, the mission of the business, insurance, is to make sure that you are not getting all the coverage you need. And even in the case of home and damage insurance, have you heard a lot of people claim about how wonderful and how quickly the insurance companies came through for them in New Orleans? No! Enough said. So that is my take on it. And Congress is getting sidetracked by insurance companies trying to keep the insurance candy wagon moving so they can keep reaping their exorbitant profits at the expense of patients. The other thing you can say is, okay, you're going to have a for-profit healthcare system. Eventually, you end up rationing the healthcare. Well, this is done right now with insurance. If you have insurance, you might get healthcare. If you have lots of money, you might get healthcare. But chances are, you have to ask a question at some point. Who deserves healthcare? Do unemployed people deserve healthcare? Do people who are disabled and unable to work, do they deserve health care? Or are some of them going to be defined as lives not worth living, or not worth helping with medical procedures? There's a slippery slope you're getting on at that point. So that's why I say it's important for us to keep our focus and keep the pressure on Congress to look at this seriously and not let the insurance companies get the upper hand, because if they do, it's going to be a pay or die system. If you can't pay, bye-bye.